Okay, now we're going to talk about showing narrowed, curved, and steep hooves. So, what are these characterized by? Basically, less transverse diameters of the foot, so I guess less width, so there's less of this part, and what you see is atrophy of the frog and other changes in the shape and quality of the horn. So if the heel is narrower, so this part at the caudal end is narrower, basically when you touch the heel walls and the corners, you'll see bending of the heels along their entire length. So you can use a mounted slipper horseshoe. So I assume it's actually this. And it also mentions Einsiedel's horseshoe and Defoe, like Willem Defoe, slipper horseshoe. And it basically has a tongue pointing upwards. Oh, I assume it's this then. At the end of the branches and of the inner upper edge. And you also have coronary narrowed hoofs. So this is a narrowing that ends up in like an hourglass shape. So it goes in and out, in and out. Think Marilyn Monroe's figure. And the hoof is wide in the coronary area. Then it narrows and gradually expands towards the foot. So a slipper horseshoe or a wide closed horseshoe with a pad and side tongues. So side tongues reduce the shock. Finally, for this presentation, we have curved or diagonal hooves. So basically, I think it's something like this. This is actually mentioned in, I think, chronic cases of laminitis. So you need a modified slipper or closed horseshoe. And with these horseshoes, the branch lies below the steep hoof wall. So I assume maybe here, I don't know. And it should be wider and thicker than the branch below the sloping side of the hoof. And you have steep blunt hooves. So basically they're very high heel walls and a relatively short and almost vertical toe wall. I don't know if it's referring to this or this. And for 2 to 3 weeks, the maximum allowable trimming of the heels is performed and the toe is not trimmed. So yeah, you trim this, not this. And that's it. Next we have hoof and digit surgery.